How does amblyopia affect a child's vision? Imagine a child trying to see the world clearly, but one is not quite seeing as well as the other. That's what happens with amblyopia, often called lazy. It mainly impacts how well a child can see because the brain doesn't develop normal visual connections during early childhood. When one eye is favored over the other, the brain starts to ignore the weaker, which leads to poor vision in that eye that cannot be fully fixed with glasses or contact lenses alone. Amblyopia causes a reduction in visual sharpness or clarity in the affected eye. Usually, it involves just one, but sometimes both eyes can be affected. Because of this, children might have trouble seeing fine details, which can make reading small print or recognizing faces more difficult. It also impacts binocular vision, which is the ability to use both eyes together. This can cause problems with depth perception, making it hard to judge distances accurately, like catching a ball or pouring juice into a glass. Beyond just seeing less clearly, amblyopia can affect how the brain processes visual information. Children with this condition might struggle with visual attention, searching for objects, or processing visual information quickly. These challenges can interfere with everyday activities such as reading, playing sports, or navigating their environment safely. Amblyopia can also impact eye movement control, which affects coordination between the eyes and hands. This can lead to difficulties with activities like reaching for objects, drawing, or playing catch. Because vision is so important for learning and development, children with untreated amblyopia might experience delays in motor skills and cognitive growth, which could influence their school performance and overall confidence. The causes of amblyopia include a misalignment, known as strabismus, where the eyes do not work together properly. It can also be caused by unequal refractive errors, like nearsightedness or farsightedness, in each eye, or by visual deprivation, such as from cataracts that block light from entering the eye during early development. These issues interfere with normal visual development during the critical early years when the brain is most adaptable. Early detection is key because the brain's visual pathways are still developing in young children. Treatments are most effective when started before age 7. Common approaches include wearing corrective glasses to fix refractive errors, patching the stronger to force the weaker eye to work harder, or using medicated eye drops like atropine to blur the better temporarily. These methods help the brain learn to use both eyes together properly. If amblyopia is not treated early, the vision loss in the affected eye can become permanent, and the child may face ongoing difficulties with depth perception and coordination. This can also increase the risk of vision problems in the stronger eye later in life. That's why regular eye exams during childhood are so important to catch and treat amblyopia early. In summary, amblyopia affects a child's vision by making one eye see less clearly, disrupting how both eyes work together, and impairing visual processing and coordination. Without treatment, it can cause lasting vision problems and impact a child's development. The good news is that with early diagnosis and appropriate therapy, many children can improve their vision and avoid long-term issues. If you have concerns about your child's eyesight, consulting an eye care professional is always the best step to ensure they get the care they need.